A patient who was transferred to a different hospital drank a dialysis solution and ended up dying. How did this happen? Let's discuss. So let's look at the timeline first. 4:21, the doctor ordered for a bowel preparation for this patient. Then at 5:34, the nurse was trying to give the medication but was unable to scan the medicine. Okay. So 1 minute after 5:35, the pharmacy was notified by this nurse that there's something wrong with the barcode. At 5:40, a new label was sent without physically checking the medication. Then, 5:40 as well, the nurse tried to give 8 ounces of the natural light or supposed to be the Go Light to drink, but the patient was unable to tolerate. At 10:30, the medication was given via feeding bag. Then, 12 midnight, the medication error was noted. 7:35 a.m., patient died. Was transferred from one hospital to the other because they needed a higher level of care. The patient was having some internal bleeding through his, I think, colon or gastric issues. So the doctor wanted to do a scope for him and check where the bleeding is coming from. So one thing that we normally do is to cleanse the bowel for these particular patients. So when they do the colonoscopy, it will be easier for the doctors to view where the bleed is coming from. So that's why the Go Lightly was given or prescribed to that particular patient. Unfortunately, a different solution was given. Natural Light, which is a dialysis solution, was given to the patient instead. So that's why the patient was not able to tolerate the first time they tried to give this medicine. And unfortunately, they did not recognize this as a sign of having a medication error, and they still gave the medication through a feeding bag tube, which of course ended up killing the patient later on. There are so many questions that runs into my mind, like what happened? And even from the video itself, they said, why was the solution left behind? Yes, that's one question. And another question to add is, where was it left? Where did the nurse pick up this particular medication? Was it from the Pixies? Was it from the medication room? Was it brought by the pharmacy? So these are the few questions I wanted to add on for that number one. Your number two question, why was the container not checked properly after it was not able to scan with the barcode system? Okay, that should be a given. And as a nurse, that's kind of like part of the basic things that we normally do is to check the 5 rights or 5 to 10 rights before giving this particular medication to a patient. So one thing, if the barcode is not scanning, is of course you have to read the medication itself and check it with the medication administration record to make sure that you are scanning the correct medicine. So that's what I normally do, or what we are supposed to do. Okay. Then number 3 question. Why did the pharmacy send a label, a new barcode or new label, without verifying the particular medication? Okay, so that's number 1 mistake. Pharmacy should have been the last straw of like a defense to prevent this medication error. And if you will listen to the medication safety officer of Ohio State Wexner University, he said, sounds like what was executed were workarounds. And workarounds were executed so would allow the medications to be scanned without some effort. So in other words, someone was being lazy, someone was like feeling like not doing their job at that time, which led to this particular error. Please comment down below on how you do or how do you settle this kind of mistakes in your particular hospital. Like for us, if the medication was not able or not being able to scan by the system, so what we normally do is we take a picture and send it through our app via our mobile phone to this particular pharmacist or to our pharmacist. Then the pharmacist will verify this, even just by electronically, like looking at the picture that we sent, that it was a correct medication. And they will fix the barcode based on the picture that we sent. So there should not be an error because the barcode that we sent was the actual label on that particular bottle or label or this whatever packaging. So it will be fixed on the medication administration record. So then we'll be able to scan it properly. So that's one thing that we normally do in this particular hospital. Unfortunately, not all hospitals have this kind of like apps that we use now. So I don't know how their system works in that particular hospital. Please comment down below how you do things in your hospital. Okay. One thing to note here, for this particular nurse, she was not committed for the medication mix-up. So in other words, she was not disciplined for this. Why was she not disciplined? It's because of few factors. Number 1, it was not her sole mistake for having this medication error. There were a lot of external factors as well. Like I said, it was a pharmacist's mistake, and also I would say it was like a management mistake as well. Why would I say management? This is why. The nurse who committed the mistake was taking care of 3 ICU patients. Again, 3 ICU patients. That's a lot for an ICU patient. Okay? And on top of that, here's the kicker. She was also being the charge nurse for the ICU unit. So ICU charge nurse plus 3 patients. So that is definitely heavy. Okay, that should not be the norm. And it is not the norm for most hospitals. Normally, it's only like 2 patients for nurses. So if you think that the charge nurse is taking 3 patients, what more are the regular staff? How many are they taking care of? Okay, so I would definitely say this is part of like a management issue for not having adequate safe staffing. Then another reason why I'm blaming the management is because of this. The same nurse was able to recognize the same mistake or similar mistake few months after having that same medication error. She was able to prevent medication error few months after this incident. So it really saved someone because of this incident. So here is the big question. Why the hell did this happen again? Okay, so this should not happen after having this kind of issue, like after killing 1 patient because of medication error. Systems or protocols or anything should be in place to prevent this from happening again. But it definitely did happen again. So that spells out there's really something wrong with how the hospital is being run or being managed. So both from pharmacies or from nursing administration side. So I would definitely be able to conclude that the hospital management has a bearing on this particular medication error. The reason why I wanted to discuss this topic because that could have been me. Yes, because one thing is it's near my place and I did try to apply in a particular hospital. So I'm not really sure if ever I encounter that particular error, will I proceed with committing the same mistake that she did or he did? So comment down below if do you think this will happen to you given the factors that the nurse was in during this medication error. Okay, so for me, I'm not sure if I could make the same mistake, but I want to hear your thoughts. Okay, so comment down below. Okay, so in conclusion, mistakes are really bound to happen, but we do have some protocols that we have to follow and we should not bypass, because whenever we bypass or do shortcut things or to do workarounds in order not to provide a lot of effort in doing some stuff, then mistakes are bound to happen. So no one is perfect. Everyone is bound to make some mistakes later on in life, or maybe they already have done some mistakes. And I really hope none of us will ever encounter or to be in this particular position where she is in, because I'm sure it's definitely not easy and it's not the best place to be in. So let me hear your comments and inputs about this particular topic.